A very warm welcome. You're watching One India English with me, Anupati Gaur. And in this episode of News Audit, we will talk about a deadly virus that has infected every mind now. Be it a discussion with families, friends, or colleagues, all discussions these days revolves around the deadly coronavirus. The deadly virus has gripped every mind. Everyone is scared. People are trying to find out as much as possible about the virus so that they can take better preventive measures. Now, till now, India was relatively safe. That's what we thought. But there were just 6 cases yesterday, but today the number of cases have surged to 28. A day after an Italian tourist was tested positive in Jaipur, 14 Italian tourists have been tested positive today. Even the Indian driver who's accompanying them has been tested positive. Now they've been sent into the INDO-TIBETAN border police's quarantine facility in CHHAWLA. Well, along with that, 6 others in AGRA who came in contact with a Delhi man infected with coronavirus have also been tested positive. The government is taking strict measures to contain any further spread of the deadly virus. All the flights and passengers will now be part of the universal screening and not just the 12 countries which had been listed earlier by the government. And the government has also said that if Iran government supports, then the government intends to establish a test lab there as well. This will let India bring back its citizens from the Iran after a thorough screening. Now, there have been over 92,800 cases of coronavirus worldwide. At least 3,100 people have died so far, with majority of them obviously being in China because it was the place where the virus broke out. Now, the government has even suspended visas and e-visas granted on or before March 3rd to people traveling from Italy, Iran, South Korea and Japan. After a surge of cases of COVID-19 in these countries, the ministry has requested all hospitals in Delhi to develop the good quality isolation wards in order to stay prepared if more cases of coronavirus are suspected in the national capital. While out of the 28 cases, 3 are said to be totally out of danger. Health Ministry has advised to avoid any large gatherings and take every possible preventive measures. Now, of course, panic has gripped everyone. As of now, question arises that what if there are more cases waiting to be found? What about the people that must have come in contact with those of the Italian tourist or those 6 people in Agra? Now, of course, we can't be sure of that. But what we can really do right now is to take proper preventive measures. So, it's just an advice that this wholly try to avoid participating in any large gathering because you don't know who could possibly be infected. And many societies have already cancelled all the holy celebrations and are avoiding all the other large gatherings as well. So if you look at the symptoms of COVID-19, they include fever, cough and difficulty breathing or shortness of breath like any other respiratory ailment. But milder cases may resemble the flu or a bad cold, making detection very difficult. Patients also may exhibit other symptoms such as gastrointestinal problems or diarrhea. Current estimates suggest that symptoms may appear as few as 2 days or as many as 14 days after exposure to the virus. While symptoms are similar, the coronavirus seems to be more deadly than the flu so far and even more contagious. The new coronavirus seems to spread very easily, especially in homes, hospitals, churches, cruise ships, any place of worship and other confined places. It appears to spread through the droplets in the air from a cough or a sneeze. The most people are panic buying these masks. Some doctors feel it is a precautionary measure, while the others, like the US Surgeon General Jerome, he feels that people should stop panic buying these masks as they are not effective in preventing the general public from catching the coronavirus. Now, the warning from the America's top doctor is inconsistent with the medical advice from the US Center for Disease Control and Prevention, which have said that there is no evidence to support wearing masks. So for your own satisfaction, of course, if you want to buy a mask, you can. But one of the most effective way to prevent catching the virus is to wash your hands properly and frequently, because if you touch a patient, if you shake hands, if you touch a door that has a droplet on it, which could happen, then you touch your face or your mouth and you will also become infected. So it's always good to keep sanitizing your hands. Also, you should avoid touching your nose, your mouth. You should just overall avoid touching your face. So whether the surface looks dirty or clean is totally irrelevant. If an infected person sneezes, a droplet, it lands on that surface. And a person who, if goes and touches that particular surface, then he would also pick up the virus. There's a possibility. And there's a study that says that the virus remains on the metal, glass, plastic for 2 hours or over to 9 days. But there is some good news. The virus is relatively easy to destroy using a simple disinfectant. So while there is still no cure for the deadly coronavirus, prevention is the only way out. If you feel that there is any symptom of a mild flu, you should immediately consult a doctor. Also, a lot of fake messages are doing rounds on the social media. Please ignore such messages and only listen to your doctors and what the World Health Organization is saying, what the health ministry is saying. That is what you should actually listen to. So stay alert and stay safe. That's all in this episode. Keep watching us and stay tuned.